Well, everybody, thank you so much for joining us at the Parent Confidence Lab by Avocado Health. We are so excited to have with us today an incredible pediatrician, Alex Butler, joining us. He's usually based in Boston, but he's in New York before he heads off to Nicaragua to help on a mission. So we're really excited that we caught you, Alex, before your big trip. Thank you so much for joining us. And to everyone listening, thank you for joining Avocado Health. We're your parent clip in your pocket, and we are trying to give you 24/7 support. And this podcast is part of that. So yeah, just to kick us off, Alex, we'd love if you could just tell us a bit about yourself and why you became a pediatrician.
Yeah, thank you, Christine and Hans, for having me and for the introduction. My name is Alex, as you said. I'm a pediatrician, mostly based up in Boston. I practice at Boston Children's Hospital and South Shore Hospital primarily as a pediatric hospitalist, meaning I see pediatric patients when they're in the hospital as well as in the nursery, so a lot of newborns. Moved up to Boston for training, and luckily my partner and I have really fallen in love with it. My whole family lives up there now, so hopefully we're in Boston for the long haul. In terms of how I got into pediatrics, I actually went through most of my training, think I would end up in neurosurgery or for a brief period of time, cardiothoracic surgery. There's still a part of me that loves the operating room. I like using my hands. But when I looked at 7 years of training and, to be frank, what ultimately attendingship looked like in those specialties, it didn't feel like what I wanted to spend my time doing. And after that, it came down to, do I want to see children every day or do I want to see adults every day? And frankly, that was a pretty easy choice. I couldn't be happier. That's the best job in the world. I get to go and really see kids and provide comfort to parents every day. And I'm thrilled to drive into work.
That's amazing. I'm sure you're such a comforting face when the parents have that newborn they brought into the world, and such a great positive energy you bring. And I imagine that you must meet so many parents who are new, they're anxious, they're perhaps, or from personal experience, they're very sleep deprived.
Yeah, yes.
What advice or tips do you have for new parents who might be listening, who have that new baby already at home and maybe struggling, or maybe they're still pregnant and they're about to approach that process? I have many friends who are pregnant right now and kind of anxious for that next step. So what advice would you give them?
It's a good question. There's so many things that they're going to do the first time. Everything that baby does will be a first, not only for the baby, but for the parent. And I think trying to go into the hospital when you have your baby and be an expert and be prepared for everything, it's just not possible. I think the most important thing, and it's the same I learned when I did my training, is when you show up, make sure that you can be present. Make sure you're available for your baby so you can really focus on them. And those first few hours, those first few days are so important, both for the baby and for you, to feel like, oh my God, I did this amazing thing. One of the reasons I actually love working in the nursery, and one of the benefits of working inside of a hospital as compared to primarily in a clinic, is I get to spend as much time in that room as I want. So when I go in and meet a pair of new parents, I can spend 30, 45 minutes just talking about baby stuff. What questions do you have? What concerns do you have? What are all these things? There's so many normal questions that come up that first day. I genuinely enjoy that. And I would say most people who work in nurseries enjoy that. So feel free to ask whether it's a nurse or a doctor or your parents or your cousin, or there are many people who have knowledge and experience about babies that, as new parents especially, enter that world. They're all thrilled to share. And I think I've met plenty of parents who want to hit that first day. I got it. I've read every book. I know all the notes. I know every rash that's fine. There are dozens of people in your life, whether you know it or not, who would be happy to talk about their own experience, and it makes a world of difference.
That sounds amazing, Alex. We know that there's certainly a lot of parents that do a lot of research. I've always said that parenting is always the number one job. If you ask any parent, that's usually what they'll say. It's really important. And that job description comes, in keeping your child healthy, happy, safe, some semblance of that, right? But when we think about all the jobs, and I know you're a pediatrician, so you've taken lots of extra years of schooling, we don't necessarily have a requirement to, from a schooling, even one course, even one semester or a class before we become parents. And so that's just a very interesting, paradigm we're in. And so to that end, while a lot of parents do actually do a lot of research, what would you say to those parents that might not have as any kind of experience, any kind of idea what parenting would be like before they actually come in and on that day, you deliver the baby or, you see those babies for the first time?
Yeah, it's a great question. I think there is the phrase we speak a lot about in medical training is like trying to drink from a fire hose. And I think for any first time parent, if you Google new parent books, right, what to expect with a baby, you will have a billion recommendations of this top rated book or article or post, and many of them have fantastic detail. I usually kind of go back to who do you know who's been through this that you trust? What do they read? More often than not, they have a stack of 4 or 5 that they really loved, and they'll tell you the names, they'll even share them with you, their notes, what worked for me. If you find yourself in a position where maybe you don't have a lot of people off the top of your head who've done this before, there are amazing organizations across the US and across states who have those really curated, detailed resources. So the AAP, or the American Association of Pediatrics, has tons of online listings. Many children's hospitals have them as well. The Nemours Children's, NEMOUR, has a bunch of really nice parent-focused kind of guides on what to expect for a baby. What does this mean that I give to patients all the time? I am, as I'm sure every parent has heard, I'm always hesitant to recommend Google, even more hesitant today to recommend GPT and AI tools. All that being said, and I hope this doesn't sound hollow, but the minute that baby comes out, the parents know that child better than anyone else in the world ever will. And a lot of the parent's job, in my perspective at least, is to bring things that I don't see. I'm not home with you. I don't get to see how they interact every day. A lot of it sometimes comes down to trusting your gut and calling someone to say, hey, something feels weird, something feels wrong. I would say the vast majority of the time, the parents are right and just don't know how to put words onto it yet. So to wrap up what was, I think, a very long answer to a good question was start with network. There are great resources. Look at the state chapters from where you live or the AAP. Do your best, but trust your gut. And if you're ever nervous or worried, always call who you know because we're always happy to talk about it.
I love that. The adage of trusting your gut, because there's a whole adage of mama knows best. Even though I'm a very proactive, fun dad, moms oftentimes have that just innate kind of nurturing sense, and they know what's happening. It makes sense. And one of the things that you said was a lot of times they don't know how to put it into words, and so I'm sure there's countless of examples where you've seen a lot of parents be very proactive and helpful throughout. And then there's others that maybe you wish they would have been a little bit more vocal and would have made a difference in life. I mean, just touch on that and the role of how a parent can really help you as a pediatrician in the role that they play and what they say about what's happening behind the scenes.
Yeah, it's great. But there's, I mean, so many cases where I find my job often being very collaborative, where I bring, let's say, my medical knowledge to the room, but the parent brings the experience and the observations and more information than I have. I would say the one that sticks out to me, just as a thread across many hospital visits, among many clinic experiences, developmental milestones are really hard. And that's on the clinical side and the family. Depending on what you read, the normal, I put normal in air quotes, but the expected milestones can be very different. Every child's different. Some hit stuff early. I know, oh, my cousin's baby is doing this, but mine isn't. Should I be worried? And the really hard part for my side, I'll be biased towards the pediatrician for a moment. I get minutes with that child in a non-comfortable situation under in a very artificial. It's almost impossible for me to get a good appreciation of that child's developmental status beyond basic stuff like can they sit upright and are they, grabbing mom's hair, which usually they do with great strength. Um, so those are situations in which if I really want to partner with that parent to say, what are you seeing at home? Do you have videos? What do you feel good about? What do you not feel so good about? Because if I try to treat with only what I'm seeing, I'm going to do a less than ideal job for that child. And that's not fair. So those are situations in which, frankly, all of my decisions are often based off of what does the parent tell me in the room. Otherwise, I'm kind of gasping, reaching for straws. And I think that's true in all scenarios, from my child has constipation to they have, we have issues with potty training or we have school troubles. There's so much I don't see in the office. And I am always encouraged when a parent comes in with a notebook full of stuff, a list of stuff, voice recorded, because it's all information we can share together.
I love that. I love that so much. And I love that you're kind of empowering the parents to kind of take it in their own hands and have all those notes, ask all those questions, be kind of their own best advocate, which we tried to say at Avocado Health as well. And when you're saying that they are saying that there are things that they don't feel that good about, what are some of the things that are pretty commonly things that parents don't feel that good about when they, come into you with their baby or child?
Yeah. So I'll touch, I guess, briefly on things like developmental milestones because I don't want to spend all my time there. It's really hard to know what to read and what should your child be doing, especially when, as my family's going through right now, many of me and my cousins are having children. So hard not to compare to similar age. It's like, well, they walked at 11 months and my child's 12 months and they're not really walking. And the AAP, even a few years ago, really extended the flexibility of their recommended milestones because we have learned over time every child is different. And because someone walks at 11 months versus 14 months doesn't necessarily mean anything when they're 2 years, 3 years, or older. Other ones I see all the time, especially in the nursery, is there are dozens of normal baby things that are brief and kind of go away. So breathing issues can be one. Very commonly, new babies can have some retained amniotic fluid. Essentially, what they're sitting in the uterus just kind of gets stuck in their nose and in their throat and some in their lungs. And over the first 24 hours, we expect them to cough it up, get rid of it. Very normal baby thing. But very commonly in the nursery, we'll hear from parents saying, my baby's breathing fast. Is this normal? And frankly, I want to hear that every time. I would rather me get to walk in and talk to them about it than they sit there in the silence of a nursery room, not knowing if their child's okay. Another one I always like to do is my own style. Every time I do a newborn exam, especially for first-time parents, I kind of walk through out loud to parents because there are baby rashes that are normal, or they have junk in their eye, which can be normal, or their butt looks funny, which, you know what, some babies have funny butts. But as long as it's normal, that's okay. And being able to say it out loud and get everyone on the same page can really, I hope at least, provide a lot of comfort instead of not talking about it and then they go and maybe see it for the first time in their house alone, and that's a very different experience.
I think I was one of those babies with the funny butts, and so I was.
Yeah, some babies
my,
have funny butts. There's no other
yeah.
way to say it.
But yeah, I mean, it's amazing. So I can, I've never been a pediatrician and probably will never be, but I can imagine that you get so many different variety of different circumstances with regards to not just the child, but also that parent, that primary caregiver, which we know that a lot of times primary care really starts with them because they have to be the ones to go to the hospital or call the doctor, make the appointment or take off work, and the decision that they're making. But I'm not sure if it's you have any training on even therapy in your medical school, but it seems like there's a lot of kind of emotions that you have to kind of even regulate with the parents themselves, because a lot of times they can be anxious or fearful or, a whole variety of different factors. How do you deal with that as a provider, and how do you, make sure that you're providing calm and comfort when oftentimes that's a little maybe outside of your wheelhouse?
Yeah, that's a great question. I think two things jump out to me. And one, to peel the doors back, I guess, a little bit on medical school and training, there is a common phrase I heard a lot in medical school, is that pediatrics is really hard because not only you're treating the patient, but you're treating the parent. And I think plenty of medical students have seen TV shows or whatever of, this parent is so difficult and I can't do my job and they won't let me do my job. And I think that's a horrible I had a great teacher in medical school who's a pediatrician. And what she told me was, and I still use this, I think, in most of my hospital visits, there with some outliers, there really are no bad parents. There are no mean parents. There are parents who are scared. And there are parents who want to protect their child and don't know how to. They don't know the words to use. They don't know what's going on. They didn't go to medical school. And I have found that if I walk into any room with that as my starting point of there is a child who I'm here to help, whether it's critical illness or not, and there are parents who are scared, I have found it's very easy to build a good relationship with that family. And I'm not saying that because I'm so great. Look at me. I think if you meet the parents that, hey, I'm pretty afraid. I'm kind of freaked out today. I had to took off work. I have two other kids at home, but I'm here with my daughter and she's breathing differently. You can meet them there and provide information and comfort, or at least next steps. I think that's 80% often of the job of a pediatrician. And it's something I genuinely look forward to doing it.
Like a lot of times, other times that parents could actually be very angry, right? There's certain other types of emotions, and how do you deal with that even?
Yeah. Yeah, and I think some parents and some patients, right? This is not restricted only to parents, but this is some patients. Mistakes can happen, miscommunications occur, expectations are not met, and I think the answer is largely similar. Treating them as a scared parent is, why are they angry? Why are they coming into my office, and are they frustrated compared to different days? It is, in my experience, almost never I'm angry just because I want to be angry, because I don't like you and I want to make your day worse. It's usually because I thought I was seeing this specialist today and it was canceled on my way in. Or I got a parking ticket outside and I don't know how I'm going to pay for it. Or, right, I have a child who is not meeting their developmental milestones and I don't know how to verbalize it and I don't know how to ask for help. All of those can explain a parent not being at their best or a patient not being at their best. And my approach that I have learned, and I've had plenty of great teachers tell me, is if you start by asking why did they feel that way, often you can make that what could have become a confrontation something much more constructive. And often we're in a position to actually help, if not solve it, at least get them moving in the right direction.
I feel like that's great advice for life too, right? If someone's having a hard emotion, asking them why and kind of what's underneath that difficult emotion.
I didn't
You
mean
can
for it
usually
to, but it did definitely tee into more life advice. Yeah.
No, absolutely. Hey, we could all benefit, right? And I mean, imagine that since you're dealing with, birthing parents who've just gone through this huge experience, this life-changing transformational experience, what kind of advice or tips do you have to take care of yourself, to take care of birthing parent or birthing mom or birthing, the father, if there's a father involved, what advice do you have for the parents, for themselves in that really difficult and big transformational process?
Yeah. Oh boy, there's so many things. And I'd say there is a lot of people who, with plenty more experience than I, who have great advice from podcasts, of books, both of you. Frankly, I would lean on both of you as resources. The simple one that I have learned, and just in my own practice experience and from family, it balances, I think, both to the providers and to the parents. On the provider side, it framed it really as being comfortable to say, I don't know. And to the family, say, right? And I think this is just as true for the family. No one expects parents to come in and be able to diagnose their kid and say, this is exactly what's going wrong. I am thrilled when a parent comes into the hospital or the emergency room or the nursery saying, hey, I noticed this thing. I don't really know why. I don't know what it means. That's a perfect opportunity for us to learn and explore that together and hopefully find resolution. The other big thing I say, and something that's so been driven into my own brain during my nursery time, no baby is raised in isolation. Truly. It may feel that way. You're alone. Your house gets really quiet after you get home from the nursery. I heard that from many parents, that first hour of silence is unnerving. But there's no baby in the world who doesn't have parents who talk to friends, who talk to family members, who talk to neighbors, who talk to peers, who can talk to daycare instructors, who talk to strangers. Sometimes my favorite interactions, I'm at a grocery store or a convenience store, and I have a conversation with someone, I learn something. And I don't think that means that parents doing anything wrong or they're unprepared or they're doing a bad job. I think both in parenthood and dealing with hard things, that's how we get through it. So to add on to there's plenty of fantastic evidence or guidance on how to be a comfortable parent and make time for yourself. I think being able to say, I don't know about your kid is great, and being able to ask for help. Because I can almost guarantee there are people in your life who jump at the opportunity to drive right over and help you work these.
Yeah, I really resonate with that feeling of coming home with that baby for the first time and sitting with, I remember with our first son, it was just unnerving. It really, like, you had this whole weight of responsibility of, now I have to take care of this whole child, and especially we're in the hospital for 2 days, 3 days, and then you have the nurses there. You can ask them
Yeah.
questions, but then you're kind of set on your own. You're not given really any instruction manual. But when it comes to, where parents are actually getting their information from, mentioning Google, mentioning social media, so we know Instagram influencers actually do play a big role there, uh, for better or worse. Now we're seeing ChatGPT and other sources. I mean, what do you say to those parents that come in and they're like, my son or daughter has this because of, X, Y, and Z that I saw from this influencer. What's your response? Is that normal? Do you get that a lot as a
So
provider?
normal. So normal. And as much as the old teaching say, oh, don't ask Dr. Google, exactly to your point, Han, if I'm a parent at home and it's silent and I don't know what's happening with my child, I'm not going to sit there in silence and not look it up. There's just no way, right? I want more information. I want to feel informed. I want to understand what's going on. I would say, generally speaking, I really like it when parents come into the hospital or to the office or whatever, having done some research, even if the information ends up being not helpful or guiding us in a different direction, because it means that they're coming prepared. They're coming interested to learn what's going on. I have no problem disagreeing with what resources they found, or frankly, I'm wrong too. I'm happy to be told I'm incorrect for something else. But if they come in saying, I did look at it, here's what I'm worried about, I can, going back to that same point of being a scared parent, I now can be very specific in how I address your discomfort or your fear. And we get to kind of do that process together. I'm always wary of using social media as a data source. And that's not to say there aren't wonderful influencers, parents, communities where you can find. I always hesitate because social media tends to show the best side of things, or at least a one side of things. And I worry getting information from that. But if that is a piece of information gathered amongst others, I have absolutely no problem. I have a friend whose child has an Instagram account. They have some medical complexity, and she uses that as an opportunity to share information, experience, to build a community. And for her, it's incredibly impactful. For the people who follow her, they get to see and learn. So I would say it's not a bad thing at all. If that's the only source of information, I just get more cautious about how do we talk about it. But if you're doing that along with good resources and sometimes just Googling, because I want to know, I, as a pediatrician, have no problem talking about it. And frankly, really enjoy talking to engaged parents who bring their own stuff and want to work through it together.
Oh, amazing.
Right. Thank you. I love that. I love thinking that as engaged, right? You're doing your research, you're engaged, and ideally finding it from more, trusted resources. But those are part of the puzzle pieces that you are kind of connecting.
Yeah.
And I imagine I think you mentioned you've been a pediatrician for about 10 years now. What has changed for you? Like, are there things when you look back, like, oh, I was such a baby at this or that? Like, how have you changed as a doctor? And then how have things
Mm.
broadly changed in those 10 years?
Yeah. So I appreciate you thinking I'm more experienced than I am. I'm in my 5th year, but I appreciate the feedback. Um, the biggest thing I've seen really actually comes back a lot to this education. I know everything everywhere right now is talking about AI tools, healthcare being no different. Providers are using a lot more tools of how they practice, and we could spend an entire, other podcast episode on that. But I think the same is true for parents. Parents, I am finding, it is easier to access high quality information. And I think that's a huge win for patients and parents everywhere. I think we as a healthcare society haven't quite figured out how to identify the best resources versus a resource that sounds very good. One of the dangers, I think, of a chat GPT or other LLM based systems is even if they're inaccurate, they can make it sound dead on. And it's a lot harder it's easy to see an article and say, oh, I don't know that I trust this one. It's much harder to see an AI output and say the same thing. But I think on a large scale, that's the healthcare system's job to start working on a little bit, and these startups' responsibilities as well. But I'm finding parents come in much more active, and they can access these questions from their phone, and they want to know. An example in the nursery, I have all the time now. I am having far more conversations now about the vitamin K injection and vaccinations than I was when I started training. And many of them have been incredibly open and very frank. And there are some parents who come in saying, I really don't know. And then we talk through it together. There are some who hold a position and maybe change that. But again, I think our job as pediatricians and providers everywhere should never be that I want the patient to walk in and say, oh, I'm just going to do whatever you say. Because that's not the relationship I actually want. I want the parent or the family to walk in and say, here's what I think and here's what I don't know. Let's find the answer that makes me happy. I will have that visit every single time. So I think that's actually a very positive growth over the last 5 years.
Yeah. It sounds like you really enjoy and really encourage parents to be proactive, to be engaged, to come at least interested in getting to a better outcome for their child. And that's going to help you as well, even if they're wrong, even if, the sources are different. I wanted to turn the conversation a little bit in terms of, some of the really interesting things that you've been doing on the technology side. And so, that you sit at the intersection of really product, data, as well as your clinical experience, which we assume that's probably the bulk of your time, but I don't know how how do you have more than 24 hours in a day? I don't know.
Practice, just raw practice.
I got to learn. I got to get to 30 hours in a day, right? We know you started something called Alcott, and just wanted to, understand a little bit more about that and what challenge that's really solving. How do you see that helping you as a provider as well as for patients?
Yeah, no, thank you for asking. For me, at least, it really spawned out of a phone call I had with my sister-in-law almost a year ago now. She had just had her first baby, and we were kind of talking about how it went and all these things. And something she said that really stood out to me was she's having, as many parents remember, very frequent doctor's visits in the first year, a couple of years of having a baby. First, it's every couple of weeks, then every month, then you're spending a lot of time in that. And what she was finding is she would often walk in with a couple things in her head that maybe she wanted answered, had noticed, wanted to talk about. Very often, that 15 minutes in the room rushes by because your child's crying, you have to do the exam, something you have a paper for. There's a lot to squeeze into that time. And then you leave and maybe your questions weren't answered. And frankly, you're not even really sure what just happened at that visit. And I don't think that's anyone's fault. I think the system hasn't handled this issue very well. And on the technical side, I thought there are some, I think, fairly lightweight, clever things we can do to make that better. Started with a small kind of coding project at home, and what eventually turned into Alcott is a website that is free for patients and free for families that allows anyone to, ahead of a visit, basically chat with Alcott and start to say, what do you want to get out of this visit? What are you coming in for? So it'll go over a little bit of the medical summary. It'll allow you to upload records, but really the biggest piece is what's your agenda? What are your questions? What are the takeaways that you as the patient, you as the parent, you as the caregiver want to leave with? And when you're done, you get this nice, easy checklist that you can look at as the patient to kind of read off of and even give to your clinician so that when you walk into the room, they're caught up. You don't spend the first 9 minutes of that 15-minute slot doing all the data collection because you got to do it at home. And, it has other functionality to extend into the visit, to record, to take notes for you, which is really nice, and even generate for you a summary. But all of this is in a free website that you can just log into. And this isn't, I don't want to toot my own horn and say, wow, what an amazing innovation. This is actually a fairly low-lift tech solution, which is intended to be. It's supposed to allow parents and families to get the most out of their visit. And when you aren't at a visit, you don't have to log back in. There's not a download. It just empowers you to make the most of that time when you're seeing your provider.
Yeah. Now, I remember that, with all of our kids, in terms of going into this, and we know you as a pediatrician have 20, 25 patients to see every day. And it's just a really, really amazing workload that you do. But oftentimes I lead those appointments and I was like, oh man, I should have asked this. And then I have to write a message in my chart.
Yes.
And it gets puts out there in the ether. And like, I don't know, maybe you'll get returned, maybe you get response, who knows? But then I started putting everything on my notes in my iPhone.
Yeah.
So,
which I love. It's a great hack, by the way. Huge fan of that.
Yeah. It's like, let me go through question A, B, C, and D. But yeah, it's just a lot that you're also looking as a provider into your own records, right? Your EHR.
Yeah. And I think I'll be very honest. I think the innovation side of healthcare, and I'm obviously casting a very wide net here, but has been so focused on helping the clinician. People who listen may not have heard of these tools, but ambient scribes, so tools that write notes for you, or healthcare summarizers, or things that read the EHR and do all these pieces, automatic billing codes. All of these are great. All of these only benefit the provider. And I think you can only squeeze so much out of 15 minutes in that room on the provider side. Really, the thing the line that stands out to me, really what I wanted to do with Alcott is I wanted for families to make that 15 minutes feel like 45 minutes. Because parents are the most engaged people in the care of their child than anyone in that system. And if you automate or innovate or build without them, I think you end up kind of stripping them of some of the agency that every parent wants to have, versus can I empower them with a simple tool to kind of jog my memory and get my agenda down so that when I see my provider, the provider's prepared, I'm prepared, and now I walk out saying, oh, look, my 5 questions, I answered every single one of them and got the one thing I wanted. And I didn't have to radically change how the clinic operates.
Yeah, I mean, when he described those innovations, the scribe and then summaries and then the billing, each one of those there's usually a monetary output there, right? Like you're saving time. You're saving that clinician time. Is there anything that Alcott would do to really save that clinician a lot of time on their side?
Absolutely. So, really the people we want to primarily support are patients, parents, caregivers. The way we generate revenue and basically work is that we actually partner with the clinic. So say a pediatric center, for example, through their existing visit reminders. I think we've all gotten text messages, emails saying your visit's coming up. We can gently ask that the patient interact with Alcott and get ready. When it's done, what we return to the clinic or to the provider ahead of the visit is this kind of pre-visit brief, right? What's the medical topics your patient's bringing to you? What's their agenda they want to go over? If they have any records they want shared, even now doing intake forms, all of that's done. So now when my patient walks in, I can address their needs. I can make them feel better. And frankly, my care is going to be better because I'm not now trying to juggle 100 things. And from a financial incentive, what we're providing to them, A, is happier patients. I think most importantly, above all the other stuff, is going to be happier patients. But Hans, you said dead on what I think a lot of providers feel is when that 15 minutes isn't used the best it could be, I have inbox messages, I have follow-ups, I have phone calls, all of which are important, part of our job to provide good care. And if I can make that 15 minutes more effective, I can probably reduce a lot of what I'm doing after office hours to make up for it. And that's really where we're seeing the biggest impact is the clinic works the same, your 15 minutes can stay the same, but I'm not having to chase things, put out small fires afterwards because I had the availability to do it when I was in the room. And that can be a really big shift.
Yes, I love that. I mean, both, as a parent, because, one of the situations we would run into a lot, and I'm sure you see this, is we're kind of unique in that I think my husband, Hans, has most of the questions, and I'm just like, oh. But then I would often take the baby and he would be like, did you ask them X, Y, Z? Did you get a response for this and this and that? And I just look at him like, oh.
Yeah, totally.
So the fact that, you can kind of prepare if there's 2 partners as a couple for that, make sure that you get your partner questions. And then I'm thinking, I'm very much in the sandwich generation, like probably a listeners. My 85-year-old father also lives with us, and I've been his primary caretaker. So whenever, he's had cancer that we're working through, he's had really bad cases of pneumonia, hospitalizations, and I'm often the one going. And similarly, I'm baby. So I have 9 other siblings asking me, what did Dr. say? Did you ask him about this? What did they say about that? What did somebody talk about his legs? What about that? And I'm like,
right, impossible. That's another 3 days of work that you now have just assumed.
Exactly.
Right.
So when I read what you were doing, I was like, oh, wow, this would be wonderful if something's just taking notes for me while I'm in the doctor's appointment, summarizing them. I can share with my siblings. My siblings can input any questions they have. So I think that this is a great innovation, not just for parents, but maybe those of us as parents who are in that, sandwich generation, taking care of our parents and our children at the same time and feeling quite overwhelmed.
I think that's right. I think really what we talk a lot about patients, and obviously that's who we're serving every day. What I think we don't end up talking a lot about is the caregivers who drive a lot of the care they receive. Often unspoken, often not present, but almost always
Yes.
engaged in the background. You said this great example of, when my father, who I love him very much, does not love to go to the doctor, doesn't love to have the questions answered that I would love to know the answer to. And if it does, by the time he gets home, the answer is like, oh, I think we talked about it. It's not a problem. That's not enough. If I can find a way
Yes.
to collaborate on the pre-visit and get together on what we want to answer, and then when it's done, it just pops up right on my phone, on my laptop, on whatever, to be able to go and see what happened. All of that quiet work that I think caregivers do at home right now, in silence of preparation, in the silence of following, if we can make that 80% easier, I think an unbelievable win, and frankly, what I want to spend the next who knows how many years building towards.
Yeah. It seems I was just thinking about the problems holistically. It's really about this information gap, right? It's like information is in different silos. It happens in some settings. It's not always distilled. It's not very open in terms of what actually gets out there. But just wondering, an answer might be what you're working on. But if you could wave a magic wand as a pediatrician and say, I wish this one thing would change and it would make everything better.
Wow.
Maybe it's Alcott. Maybe that's it.
No, that would be that's too lame of an. I can't do that. I'll pick something more fun.
Yeah. So what's one magic wand wish that you could actually do?
Wow. All right. Can I steal it and make it two? Okay.
Sure.
I'll start
Absolutely.
with the technical one first. There's pretty good evidence that about 40 to 50% of what's said in any room, hospital room, nursery room, visit room, is forgotten within a day. And that doesn't serve anybody. And I think anyone who's in healthcare, anyone who's had a doctor's visit, is familiar with these forms we call after visit summaries, these printouts of what was done. To cast it in the nicest light, I find those largely legal documents with a bunch of words I never read, and really actually doesn't provide me a summary of what we talked about. So the first thing I really would wave a magic wand for is taking some of the scribe technologies that are writing the physician or clinician notes. I would love, as an industry, to turn those towards also generating information for the patients and families. Technically, very easy. There's not a big barrier to turning those tools into a slightly different output format. The complexity here is going to be some medical legal, and to be very frank, is providers who don't love the idea of being recorded. Many large hospital systems actually have blanket statements where the patients cannot record their provider, and I recognize where that comes from. I don't want to be secretly recorded either. But in a world where providers are more frequently using visit scribes for their notes, I think it's a little bit unfair for us to say that patients can't do the same. Because I think the information gap, as you said, is a huge problem. The second one that I'd love to wage a wand for, and this one it's much softer. I would love for every new parent to once in a while to feel like that they can tell themselves, I'm doing okay. I think it's really hard for first-time parents to ever get to that point, because there's a lot of stuff you read saying this is what amazing kids should be doing, and this is what you should be doing, and why are you not exercising and eating clean, and they're not watching television, and you can never give them medicine, and everything's fine. That's not how most children grow up. I think every parent is doing the best they can. I wish every parent could at least occasionally feel like we're doing a pretty good job.
That's amazing. I think you're about to make Christina cry over here.
What a perfect way to end, right?
Yeah. No, that's very, very sweet, very sentimental, and that definitely very, very much needed. And, on that note, we've talked a lot about this, when we compare to the social media influencer who only puts, the, best things. Hey, my child's doing this, and I made this meal, and this, that, and the other. And the expectations that society puts on us inadvertently sometimes as parents kind of, creates an artificial hurdle for us to kind of say, well, if I'm below that level, what am I doing? Who am I? Like, am I doing the right thing as a parent? And sometimes we have that doubt, and, more often than not, that's not necessarily constructive. And so one of my life, mathematical equations is really happiness equals outcomes minus expectations, right? I didn't want to get
No,
philosophical,
I
but
love that. I'll even say, so
it-
4 hours ago, right? I'm in New York today. 4 hours ago, I was seeing a very close friend of mine has a gorgeous 20-month child. Fantastic. Doing great. Like genuinely is off. And we went to go get ice cream. And in the midst of not 5 minutes, tantrum, yelling at the ice cream shop, saying no, wants to get out of the stroller, wants to get back in the stroller, the joys, as you both know, of parenting. And this is not in any way to speak negatively, but the pictures that were shared later that day were smiling, eating ice cream, having a great time, right? And this isn't social media. This is one of my closest friends, and that is what we share. And I think that's all of us. I think no matter what social media app you use or none of them, it's almost impossible, as you're saying, not to have these expectations of, oh, they went to go ice cream and look how great he did. But who sends pictures of, this is my 2-year-old on her back crying in the cereal aisle? That doesn't share it easily, know? But it happens.
Alex, you made me think that maybe we need to start a movement like hashtag this is real parenting, because it would be so funny if you would just see all the behind the scenes pictures of the child screaming, throwing their purple cup because they wanted the yellow cup, like knocking their siblings' ice cream down because they wanted that ice cream.
Them? I can't find them in the house somewhere. Happens. It totally happens.
Exactly. And it makes me laugh because my father is one of 3 kids. He's from Cuba. And he always felt like the lesser loved kid. He's the middle child. And they have these like beautiful portraits of their babies, the 3 babies when they were children. And like his older brother has this like beautiful, like perfect, like I look like a little cherub picture. And his little sister is like perfectly dazed. Her hair's all done and she's adorable. And then the picture of my dad is him on the fence just screaming and crying like, ah!
Great. You know what? Good for him for lowering expectations. That's exactly what we should be doing. Good for him.
But he's like, this is the story of my life. I'm the one, I get the crying baby portrait, right? But like, that's real life, right? And he had 10 kids and I say he's kind of the baby whisperer, but that's real life. Those are the moments that you're right. We don't see, we don't hear about. You just see all the glazed over photos. And
I think to bring it all the way back to the beginning of the podcast, there are, as you have the knowledge. If people were to ask you, hey, my child has having a tantrum, is that normal? You would say, of course it is. So this is, again, we're accessing your network, your parents, your siblings, your whomever you have, these questions that can feel monumental and embarrassing. And what am I doing wrong? And why am I so bad at this? More often than not, in my very limited experience, normal. Oh, did your kid poop on his diaper and it's everywhere in your house? Yeah. Do you have a child? There's no magic to that. That's just what they do.
Yes. And that's, as a mom, as a co-founder, as a coach, one of the things I always tell my clients and my friends who have babies, especially once you become a parent, it's like, how would you mother yourself? Or if you're dad, like, how would you father yourself? Like if your child came to you and said, I am so overwhelmed, I have a 6-month-old baby that won't stop crying. I'm not sleeping, and they threw a tantrum in public. I'm so embarrassed. You would tell your child, like, it's totally normal. It's okay. Like, this is some of the hardest months of your life. Like, it's going to get easier. You're going to learn. You're going to feel more confident. Like, pat yourself on the back. You're not sleeping enough. Like, we can be so kind and compassionate to other people, and especially like our children, our nieces, nephews, younger people around us. But then we can be so hard on ourselves.
Completely. And my partner taught me this more than any degree of medical training. Sometimes just being able to say the things you said is like 60, 70% of the road to improvement, right? If you're having a terrible day, sometimes just either talking to your partner, talking to someone, calling someone and saying, man, my kid will not potty train and they're eating nothing. And I'm so worried. And also work is all these things, just being able to say them sometimes is a lot of the battle. And to have anyone, doctor or friend or nephew say, hey, you're doing a pretty good job. I think that's a huge win if we can all do that a little bit more.
Yeah. We all need a little space to vent and definitely get those frustrations out because it is the hardest job in the world. And one of my other philosophies is I never try to rationalize with my 4-year-old. drums when it's like they want the pink cup and not the purple cup. I'm like, all right, I'm not going to fight. I'm not. That's one fight I'm not going to pick. But it's yeah, it's definitely very very useful. We also, we have a number of parents that are listening to this. Will listen to this. What is one advice that you wish all parents can know?
I think the two things that I would tell every parent, that I try to tell every parent, uh, one, it is okay, and you should say, I don't know, and I want help. I know I'm kind of calling back before, and that's obviously my experience is much more in the hospital, in the clinic side. I so strongly encourage parents to come in and say, I don't know what's going on. I don't even know how to name it. Something is different about him than it was at our lab. If I don't know you feel that way, I can't help. And if you tell me, I will leap over hurdles to figure out why something feels different. That's exactly why I went into medicine, is why I went into pediatrics. So I want those gut instincts to be made verbal, even if at the end of the visit we say, I'm feeling okay. Nothing is concerning me. And then the second piece ties directly into that, which is, and I truly tell every parent this in the nursery the day they go home, from the minute that baby is born, especially when you're leaving the hospital, the parents know that baby better than anyone ever will. In the history of their life, you know them better. So no matter what provider, healthcare person, family member says you're wrong or changes or stuff, I don't worry about it, always trust the gut, because you just know them better. I don't know what their cries sound like. I don't know if they've had that rash before, what medicine works for them. I'm always happy to talk about it, but truly, truly, I will never know that child as well as you do. And I want to include parents as team members in any decision making. Because if I'm not, I'm giving up 80% of the information I could be using, and I'm going to provide less good care than I could be if I invited the parent to be a part of that decision.
Oh, Alex, thank you so much. And it meant to be a wrap-up question, but I had a
Please, yeah, go.
follow-up one listening. And I think, given our history, having a child, who did have a medical condition and kind of one that doctors couldn't even understand, and talking to several other parents who've had kind of things go wrong along the journey. What do you say to that parent when you do flag something for your pediatrician and you feel like they kind of shoot it down? Oh, that's just normal. But you still know in your gut, like, that's not just normal. What do you say to them? Do they look for a second opinion? What would you
Yeah, it's
recommend?
a good question. It's probably the hardest part of medicine in general. And I don't know that I would say pediatrics is different. I think it may be a little harder in that you're dealing with a child who oftentimes doesn't know how to verbalize it themselves. I would say, to answer your question, you should always, again, feel empowered to talk to your provider. Hopefully, your provider is active and engaged and wants to help. And when you reach that point of, I don't know, doesn't say, oh, throw my hands up, I guess we're done, I don't know the answer, but is saying to you, I don't know, let me see who else I can bring into this who might know better. Because truly, in that situation, that's our job. When I reach the end of my knowledge level, which I will happily admit is limited in many areas, I find people who have knowledge I don't have. We have consultants, we have specialists, we have more experienced peers. There are many people in my network who I can bring in and provide information I may not have. Online resources, right? With the growth of AI, all these things, that's my responsibility now. I don't want the parent to go home and have to be reading a bunch of academic papers, because that's not what I expect from you. You can feel empowered to, but that's my responsibility in that relationship. And I think, to be truly candid, if you get to a point where your provider, your care team says, I'm not doing anything further, we're done now, I'm finished with this, but you as the parent still feel that sense of something's wrong, I would never, as a provider, feel hurt or uh, you know, something negative about me if you wanted to speak to someone differently. I'm just one doctor. There are many of us. Many of us have different styles. So whether we call it a second opinion or speaking to someone else, or even in cases where this relationship can erode, which certainly happens in these complex and challenging situations, finding a provider who does do what you feel like you want them to do and strives for that next answer, I would empower parents to do it every time. Because if you feel like you can't go to your provider and that's not your champion, that relationship is going to be hard for the entire life of your child as young.
Awesome. Awesome. Well, this has been amazing, Alex. We really appreciate all the time, knowledge, wisdom that you've given us and shared with all the parents that are listening to this. And so thank you for coming on. We know that parenting is one big experiment. And so thank you for being part of the Parent Confidence Lab.
No, thank you both for having me. Amazing questions. Really glad we got a chance to talk. This was really fun.
Awesome. All right. I will